Thank you all so much for being here. If you've been in contact with me recently, you know that I am really excited about this panel and have been talking about it to everyone that will listen to me. So just for a little heads up, what we're going to do is get started. You can see we have our awesome moderator, Bomani Jones, here with us, and our awesome panelists who will be introduced in a bit. We're going to actually kick things off with a video from a couple of our biggest champions on Capitol Hill, Senators Chris Murphy from Connecticut and Joni Ernst from Iowa. They've got a joint video that my colleague Sydney here is going to play for us. And then after that, Bomani Jones, our moderator, is going to jump right in. Bomani, I'm super excited for him to be here. He's a multi-platform host, commentator, and anchor of ESPN's The Right Time with Bomani Jones. And as a sports fan, I'm excited because I love listening to Bomani and his analysis on basketball and football, hot takes, and as we actually talked about a little bit backstage, his Twitter banter with Buffalo Bills fans and all the donations to the National Diaper Bank Network that has generated. It's been fun. But he also has an economics background as an advocate for economic justice, and I think is going to bring a really great perspective to the panel and great interactions with our really awesome group of panelists. So like I said, we're about to play the video. This is the last you'll be hearing from me. After this, Bomani Jones is going to take it away. Thanks everyone so much for joining.
Thanks, Philip.
Hi everyone, this is Joni Ernst, Junior Senator for the great state of Iowa.
Hey everybody, it's Chris Murphy, U.S. Senator from Connecticut. And an evangelist for the importance of supporting diaper banks.
Well, I'm sorry I can't be with you all in person today. I'm honored to share a few words.
This is one of those aha issues for people. Millions of people never thought about the lack of access that poor families have to diapers until you tell them the story.
First, I'd like to thank you all for the critical work you're doing to support new moms and dads in Iowa and across the country.
We don't subsidize the basic items that you need to keep your child healthy. And as the parent of two young kids, I know how expensive diapers are. And that's one of the reasons that I work so hard on this issue.
We know that having access to clean diapers is a basic need for families that can't be overlooked, particularly during this pandemic.
Thanks to Joni Ernst, our Republican co-sponsor, we've built a bipartisan coalition around new support for diaper banks during the pandemic. Joni and I introduced a bill putting $200 million of federal money behind supporting diaper banks.
We also know that diaper banks in Iowa and across the country have faced serious challenges, which is why I'm proud to team up with my Democratic colleague from Connecticut, Senator Chris Murphy, on bipartisan legislation that would provide $200 million in additional funds for diaper assistance.
This pandemic is still around. The economic effects of the pandemic are going to be felt for years moving forward. So that legislation is going to continue to be important. We need your help to push it.
New parents in Iowa and across the country shouldn't have to worry about having access to clean diapers, especially during a pandemic. And this bipartisan bill will go a long way in helping address those challenges.
So thanks for telling the story of diaper banks. Everybody that you touch with this story becomes a convert, both if you're a conservative or a liberal. And that's the reason we've been able to build this really good bipartisan coalition. Your work in reaffirming your lobbying efforts will help us get this legislation passed.
Again, thank you for all you're doing to help families get access to clean diapers, a necessity for the health and well-being of every young child. In the Senate, I'll continue working to support low-income families and frontline workers who are in critical need of diaper assistance. God bless you all.
There we go. This would be a lot more helpful. Thank you, Joanne, and thank you so much for joining us here. And
Thank you to Philip for the introduction, and I want to give an introduction now to our panel. First, we have Stephanie Childs. Stephanie is the Global Vice President of Government Relations, at Kimberly-Clark Corporation. Joanne Goldblum is with us. She is the CEO of the National Diaper Bank Network and also the co-author of Broken America, Seeing, Understanding, and Ending U.S. Poverty. Razia Hill also joins us. She is the executive director and founder of Every Bottom Covered in Buffalo, New York. And Dr. Myra Jones-Taylor joins us. She is the chief policy officer of 0 to 3. So thank you so much to everyone for joining us on the panel. And Joanne, I want to start with you. You and I first got introduced about 2 years ago in 2019. And that's when I became aware of your work with the National Diaper Bank Network through my friend Eric Adelson. And so I was just wondering if you could describe briefly the work that you've been doing for the last 10 years.
Sure. I remember that day very clearly. We were at a coffee shop back when we were still able to be out. So the National Diaper Bank Network, we're heading into our 10th year, our 10th anniversary, and we support diaper banks across the country. We have a membership of well over 200 independent organizations like Razia's, which you'll hear from. And those diaper banks and period supply programs give product to individuals who need it across the country, and it's always done free of charge. And the other thing that we do is work on policy, because that is really where the change will, where there will be enough change that we can really conquer this problem. We're incredibly lucky that individuals are generous and support us, and corporations like Kimberly-Clark support us. But really, to address the issue that we have on the scale it needs to be addressed, the thing that we're missing is governmental support. So that's another really important part of what we do. And then the third thing that we do is research around the issue of diaper need. And many of you may have seen, there was an amazing article today in the New York Times by Jennifer Gross that really focused on the work of Dr. Jennifer Randles from, I'm now going to blank where she's from. She's from California, but she has done some really interesting research about diaper need, as have many others. So that's the third sort of rung of the work that we do. So I'm really happy to be here, and thanks for hosting us.
No problem. Now, the term diaper need, how would you define that for us?
Sure. So diaper need is simply not having an adequate supply of diapers to keep your child clean, dry, and healthy. And that can be cloth or disposable, whatever it is that your family uses. But experiencing diaper need is when a parent or guardian who is ever taking care of the child needs to leave their child in a diaper longer than is healthy or best for the child.
Right now, you describe diaper need as a public health issue. Now, how has your organization been the driving force of building awareness on this issue?
So that's really in large part through the research, that we are able to do that. We work really hard to find different ways to talk about the issue. And we also really feel like the fact that it has been quantified as a public health issue through some of the research that's been done really helps when we're talking to elected officials and things like that, because it's not, diapers are not a luxury. They're a necessity. And that's really the difference between something that is a public health issue and isn't.
All right, now, Razia, I want to go to you because your experience as a mother in Buffalo kind of pushed you toward the work that you do with Every Bottom Covered, which is what you founded in Buffalo. So could you tell us some about your experience in the work that you're doing?
Yes, absolutely. So as you stated, my experience as a single mother who's raising a child in a low-income household definitely catapulted me into this work. I was able to experience what these families are going through. I've gone through every low income program available in our community. I've seen the deficit in those programs. I've seen the lack of diapers available in our community. And so when I was in a position to do so, I really just took from my own experience and did some research. Thank you for the research, Joanne, and National Diaper Bank Network, because through that research, I was able to understand more about diaper need outside of just the actual physical need of diapers, and launched Every Bottom Covered in 2016, and have been working since then to just continue to raise awareness and to fill that gap in my community.
You know, one thing I talk to people about in this pandemic is a simple point, but I think it's something that's easy to get, is that every other thing that's happening in the world is still happening. On top of it, we have a pandemic that is taking place. Like, all the real world stuff hasn't stopped. So what has been the demand for your services during this pandemic?
We have been, before COVID, have already been serving 1 in 3 families who are lacking in diaper need in our community. But we definitely see more people coming. We see clinics reaching out on behalf of their patients. We see social workers reaching out, a lot more home visiting programs reaching out on behalf of the clients that they serve, because families are not able to get to us as easily. And families who did not have this experience previously now do have the experience of diaper need. So we've definitely tripled the amount of families that we're serving. We do direct distribution, so we serve the families directly. But we've also opened up the reality that there's so many other issues, like you said, like transportation. A lot of families are in rural communities in Western New York and can't always get to the urban community that we're in at the Delavan Grider Community Center to get the supplies. So it's really opened up a lot of conversation around expanding the work into rural communities.
Yeah, I think the point about rural communities is interesting, because I know in like the development of Africa post-colonialism, for example, one of the great questions was, where do we put these resources? Because there's so many people who are so far flung, but the concentrated populations are in cities. And so it can be very easy to forget those people who are farther out. And my question for you is, if you're tripling the number of people you are serving, how are you doing that? Because that is an incredible increase in what you're doing in a relatively short period of time.
Well, we're doing it with the generosity of donations that we've received. We've received very generous donations from National Diaper Bank Network. The community is stepping up as well. We're receiving more grant money than we have in previous years from COVID funds that have been established to address the need. So we're doing it by the work of the community. I really could not personally take credit for it. We are just meeting the need with the assistance of the community and with the assistance of our networks.
All right. Now, Myra, you are recognized as a leading expert in child poverty in the United States. And I just wondered if you could give us an overview of what 0 to 3 does.
Sure. Thank you so much for having me. So 0 to 3 we have a very simple mission, and that is to make sure that all babies have a strong start in life. We know through research that the first 3 years of a child's life are foundational for all future success through learning, cognitive, social, emotional development, all the things that we want to see in adults and young children starts in the first 3 years of life. And so we make sure that parents have the support, the resources, the information that they need to first be, healthy individuals, but then of course be healthy and strong parents for their young children, and then make sure that caregivers and professionals and of course policymakers are clear on their role in making sure that all young children have what they need to thrive.
All right. Now, we've had a change in presidential administrations. How do you expect that will change the policies that we will see on these matters?
Well, parents and families have really borne the brunt of the pandemic. We have seen that, clearly through so many different ways. I don't need to enumerate them now, but let's be clear that even before the pandemic, parents and families, young children were really struggling. 1 in 5 babies lived in poverty pre-pandemic. And I will also be clear that there has definitely been a seismic shift with what we just saw this last week with the passage of the American Recovery Plan. It is truly historic, the investment in young children and in families. And so we are hopeful that this work will continue. We were thrilled to see a huge increase, a necessary increase in childcare. This is a broken system that so many of our families rely on. And so this was, shoring that up with $50 billion combined investment was critical. The child tax credit was absolutely fundamental, but all of these things that we care about need to be made permanent. So we have to make sure that all these resources get out to families this year, and then make sure that beyond this year that they are made permanent, so that we can really get this country back on track to where it needs to be.
One thing I think that's interesting is, as we're having this panel and a lot of things you're talking about, it seems a lot of what we're talking about is about awareness, but like, it's almost to me in a way, like when we talk about cancer at this point, people are like cancer awareness, and every now and then I pop up and I'm like, so who are these people who are not aware of cancer, right? Like, I feel like people are up on game at this point. But with poverty, it does really seem in a lot of ways that people are truly not aware of how broadly it reaches, which seems kind of strange because it reaches broadly. Like, it's not like it's reaching, you know, like it's not as though it takes, you have to, it's a very small portion of the population that has zero interaction, even if it's just with their eyes, of poverty. So how is it that we reach a point where so many people have to be told that these are the issues?
You know, I think that's a really good point. And sadly, I think the pandemic has made this unavoidable. And so you're absolutely right. The idea that people could go around in this country and not recognize that 20% of our babies were living in poverty and 40% were living near poverty, right? So I think what we have on our hands right now is a sea shift, a sea change, and that people actually recognize that this could happen to them, right? We don't want anybody to live in poverty, and we don't want it to happen, people to have recognition once it happens to them. But that's where we are as a society. The good news is that we know the pathway forward. We know that there are durable policies that we should have had in place for years, that are now being put in place through the ARP. You know, Joanne wrote this incredible book that I think people should read about and see there is a clear pathway forward to make sure that nobody can, you know, turn a blind eye to what so many families and children are experiencing. We're talking about housing insecurity, food insecurity, food insecurity, and of course, diaper need. This pervades every community across the country. And so, you know, the time to stop looking away and really address what has been in our face for decades is now.
Now, 0 to 3 has what it calls the Think Babies campaign. What are the key components of that?
So, you know, 4 years ago, before the last election, we realized that families and babies were not getting what they needed. There are so many indicators that we found across our State of Babies yearbook to make that very clear. And so we said, we need to shake things up. We need to bring awareness to this. To your point, we need to make sure that people understand what is happening in their their own communities. And so our purpose is very clear: to make sure that babies are seen as a national priority. And so we do this through a few ways. We think about childcare, early Head Start, making sure that those fundamental components of any stable family and working families have what they need, and it's high quality, it's affordable, it's accessible. We think about food and healthy, you know, nutrition for families. We think about housing. We think about so many different things, and we do this across multiple strategies, if you were to use advocacy speak. So one is just data, making sure that people understand what is happening in this country. And we do that through our State of Babies yearbook, which we will be releasing a month from now. So hope people will pay attention to that and check that out. We also do that through partnering with organizations. And of course, the National Diaper Bank is one of our key partners. We're so proud to partner with them, making sure that we are doing this across the country, a groundswell of support. And then, of course, we work with parents. And so we have something called Strolling Thunder, which will happen 2 months from now, where we bring families from all 50 states and the district to meet with their members of Congress to tell their personal stories about how they are being affected by the lack of family-friendly policies and lack of baby-friendly policies in this country. And so together, we do this in a way to raise awareness to what families need and show again that there is a path forward, that we know that there are durable policies that we need to be putting in place that will be better, not just for babies, but for this entire country.
All right, Razai, I want to jump back to you right fast, because one thing I think is worth noting with you on the ground and the work that you're doing is that you are seeing with your own eyes the impact of these donations and people having these needs met. So could you tell us a little bit about what your experience has been and what people have told you about how much things are made better just by having these simple supplies?
Absolutely. So I get to do direct distribution and talk to the families directly. And I think that is a blessing in this time, because you really get to see the people that you're affecting. People who have not had to deal with this type of need prior are coming in and they're relieved. They're relieved to be able to come in to get resources immediately and to get assistance navigating into other low income services that we're offering. So we don't often think about how it's such a simple need of a diaper, but it is so important, so important to be able to talk to families and to be able to let them know that they're not alone, because this is a time where people can feel very isolated just from the things that we're not able to do in the world. But I get a special joy when I'm able to assist families, when they're able to come in and get the resources and just let you know, thank you. I mean, they're just thankful because it's just some red tape that's taken out. They don't have to run somewhere else. They don't have to be put on the waiting list. You know, they're able to just come in, get diapers, and go on to handle whatever else in their day might be affecting them. Because as you so eloquently stated earlier, all the rest of the things are still going on in the world. Just laid a pandemic on top of that. So nothing is nothing is different in the good way. It's all just more stress in an already stressful situation.
All right, now, Steph, I want to go to you because you're representing Kimberly-Clark. You manufacture Huggies and also the U by Kotex and brand of period products. And why is your company concerned about access to these things and the struggles of people in this country?
Well, I mean, caring for families is really foundational to Kimberly-Clark's purpose. And I really feel like as a manufacturer of essential products, part of our obligation is to use our platform to support policies that help moms and babies, and that to use our voice to speak for those who are less able to speak for themselves. And when I took the helm of the government relations department at the company, my job is really to interface with governments. And so part of my mission in this role is to bring these issues, raise awareness with policymakers, and talk about the need, because it's something that we can do as a corporation. And I think it's going to take corporations, nonprofits, and government working together to really alleviate the poverty and some of these access to essentials issues.
I think you make an important point there, because it's one of those things that kind of exists directly in our faces, but we don't really think about, is that so much of the brunt of doing for others is basically placed on rich people to get a lot of money and then give it away in this kind-hearted manner. And then the government is able to divorce itself from the process, right? Like when you like, this is what we expect so much. There's like the ideas of responsibility of those people. But why is it so important that the government actually get involved rather than just simply having other people invest or donate money toward these causes?
Well, I think, as Joanne said earlier, I mean, it's a public health issue. It has massive macroeconomic consequences. And so there's a myriad of issues around this, policy issues, where electeds can get involved and support policies that ensure access to period supplies for girls in schools, for example. We're supporting working moms whose kids are in daycare to make sure that they have diapers and supplies for their children while they're in daycare. They can, support pre and postnatal care for moms and babies, particularly in underserved communities where, there may not be adequate access to affordable and quality health care. So there's just a myriad of issues. And I know folks on this panel can speak to them even better than I can, but there's a myriad of public policy issues around here that are crying out for attention from public policymakers. And I think the Biden administration has taken an important step into helping to bring some of these issues to the fore. These issues need attention, and it's a critical time for us to really address them.
I think using the word macroeconomic is very important, because I think it's easy to view this, when you start going to the economics of things, for people to view this as almost a cynical outlook. But the truth is, like, I felt when the pandemic came down, like a significant reason to get this taken care of is, even if you are just a cold-hearted capitalist, dead people can't buy stuff, right? Like, there are real ramifications to these things, and like the long-term health of these children, as we talk about it, like, as much as we know the importance that capitalism plays in this society and governing behavior, it is interesting that people do not realize that investing in these people is also investing in the economy that lords over us all.
Yeah, and I think corporations really have a role to play in lobbying for good. We have this platform, we have government relations departments, we have advocates. And I think, matching those purpose-driven issues that have strong social impact consequences, I think it's time for corporations to step up and really help play a role in driving solutions for some of these issues.
All right, Joanne, you had something you want to add?
Yeah, I was just going to say, one of the things, going back to what you brought up earlier about why do so many Americans sort of not see poverty? I think one of the things that we deal with, and one of the reasons government should step in, we all pay taxes, right? Why is it that we think of money from the government as belonging to other people, right? The people who need help are the people who have paid taxes, right? It goes around. And it's one of those economic issues that I don't really understand that well. Why is it that we are so, that the idea of using taxes to actually help our fellow citizens is so problematic?
All right, now, Joanne Razai, I want to ask you too this question. Like, how do diaper banks work? Like, even I give every month to the diaper bank and I've done work, but I'm trusting that you guys are getting this stuff done. I believe you, but I really don't understand how it works.
Rizia,
Yeah,
do you want to talk about how yours works, and then I'll talk
sure.
about the general others?
Sure. So we do direct distribution. It's important that the diapers get directly to the families without any amount of red tape. So families come in, we have a small application, they fill that application out, and they leave with supplies immediately. We do service low-income families, so we do ask that they bring some type of proof that they are in a low-income situation, but we don't ask to dig too deep if they bring a benefit card or bring a WIC card or Medicaid card. That is sufficient proof for us. And the families can come back once a month until the child ages to 3 years old. So that's pretty much our model.
Right. And so the model that Rizia just talked about is a model that many diaper banks use. Another model that many other diaper banks use is distributing through agency partners. So they work with shelters, daycare centers, religious institutions, federally qualified health centers, things like that. And that way, the organizations that work that way see that as an opportunity, so that families don't have to go to a different place. And so, things sort of work differently in different communities. And one of the things that we really believe strongly at the National Diaper Bank Network is that the people in each community know how to make it work. So, we wouldn't say to Rizia, you should use this model. She knows what works in Buffalo. And each of our programs has has some sort of either mostly agency partners and some direct distribution, or mostly direct distribution and some agency partners. And we encourage organizations to give 50 diapers per child per month, because that is considered a supplement that is significant. And we know that from research that was done a long time ago. The first bit of research that was done, and it was actually industry sponsored research that was done by Huggies in 2010, the Every Little Bottom study.
Right. Now, Stephanie, I know Huggies donates a lot of product to the National Diaper Bank Network. Like, what are the current numbers now and what you guys are able to do with them?
Well, I'm really proud to say that we've donated a minimum of 20 million diapers annually since 2011. So it's more than 270 million diapers combined, and we'll continue that commitment. We're a founding sponsor of the National Diaper Bank Network, and we just couldn't be more committed to the mission.
Right now, Myra, what is the importance of advocacy with this cause?
I love that question. Before I answer that question, though, Bomani, I want to get back to this question around, why we need to have public investment here. And it's really important to understand this in terms of a social contract that we are making with, this country, that when we invest in families, when we invest in babies, we all benefit. And so the idea that this is something that is, about deserving people, or, they shouldn't be getting it, that's nonsense. If you shift this to think that we will all do better when we get away from this idea that 20% of babies in poverty is acceptable. I mean, that is fundamentally, we are in a broken system if we accept that is okay, given all the research that we know about what happens in brain development when young children go without, when they are living in poverty. We know that this disrupts all of the incredible brain development that's happening. So I think we need to have this shift, that this is really about investing in our families, and we're not going to accept these numbers anymore. And so speaking of advocacy, you know, the fact that we are where we are right now, that the ARP just passed, and that we are thinking of, you know, we now have families who will be getting a child tax credit, a periodic, you know, investment in families is huge. The fact that we now have, as I said earlier, you know, a historic investment in childcare to actually fix the system that has been broken for so long, when you consider that 50% of all families in this country live in childcare deserts. They live in places where childcare is inadequate. We know the numbers about diaper need, right? So that didn't just happen because somebody woke up and thought this is a good idea. That happened because there were policymakers like, you know, Joni Ernst and my former senator, Chris Murphy, who had these ideas, but it's also because you have advocates like the National Diaper Bank, like 0 to 3, who are helping to inform policymakers, make sure that they understand where their priorities should be. And then we have this chorus of you know, grass tops, the organizations who then mobilize folks on the ground. We have grassroots of people who are just fed up. And by calling their members, by sharing their stories, by telling data-informed stories, all of these things together are what got us to where we had that historic, you know, passage of the American Recovery Plan. That doesn't just happen on its own, and that drumbeat has to be maintained. And so our Think Babies, you know, our policy network is incredibly proud to be able to think that we have helped contribute to where we are. I'm proud of the Diaper Bank and all the work that they have done, that you all have done to make sure we get there. But advocacy has to be supported. We need to make sure that parents understand the power that they have and really set them up to tell these stories, because policymakers need to understand what's at stake. And that's what advocacy is all about.
And now, Joanne, are there enough donations of dollars and diapers to meet diaper need as it is in the United States?
So, you know, it's funny. That's a great question. People and corporations are incredibly generous. No, it's not enough to meet the need. And that's why we need a policy solution, because there is, I mean, I guess I can't say there's no individual. There are probably a handful of individuals who could individually address this, but very few of them, and they're not going to. It needs to be a governmental response. You know, we have seen incredible generosity. You know, people give really, really generously. But one of the things that that we actually talk about, you know, Colleen and I talk about in our book, the fact that the gap between how much money U.S. Americans make and how much it costs to live in the US. And the numbers just don't match. And so that has to change. Now, how that changes, there are lots and lots of possibilities, right? We could give everybody free diapers. We could give more money, you know, we could use a universal basic income of some sort. You know, we can do lots of things. We could raise the minimum wage so that working people didn't have that gap. But something, as Myra said, something really significant has to change in order for us to be able to adequately meet the need of so many families in the US.
You know, and Myra made an interesting point about investment. I remember I had a professor in graduate school who made the point that the GDP equation of consumption plus investment plus government spending, he said he always felt like it was done wrong because of what we call investment, like education spending was treated as consumption rather than being treated as investment. And like, I was thinking about that, where we underfund schools and then we get mad when those kids go rob people, right? Like he may have could have done something on the front end that could have made things easier on the back end. And it makes me wonder, is the fundamental problem that we have on this one of empathy, because so much of this seems to be people looking at poor people as being other people, and also just looking at the people and who gets supported by the government as a them instead of us situation, even though, I mean, clearly the us part, we, as much as we may try, we cannot be separated from one another.
Yeah, I think you're absolutely right, Bomani. I think it's a lack of empathy. And sadly, again, we don't want anybody to suffer, but hopefully the pandemic has opened people's eyes to what it means to go without and how stressful that is to families. You know, but there's also, I think, a lack of attention to the power of policy. So many people don't understand the role that public policy plays in their lives. And so I think when you think about infrastructure, people get on roads, those roads were public investments. They were created because somebody said we need to have commerce go back and forth. We need to be able to communicate, travel, all these things, right? The same thing needs to be said about all of the things that families rely on. We need to have a fundamental shift along with that empathy and how we think about infrastructure. And we need to attach care to that mentality, that we need family supportive policies. And I will start with a care infrastructure that recognizes that families, we need policies that support families across the lifespan. So with paid family leave, starting there, childcare, with elder care and long-term disability care, all of these things for people to have dignified, meaningful lives. We need to invest in both caregivers and make sure they have adequate jobs, that they are paid well, that they don't need to rely on food banks and, God forbid, diaper banks. We need them to be there when they should be there, but we need to be shrinking the number of families who need those in the first place. And we also need to think about the folks who receive the care, from babies and young children who are receiving childcare, from folks who are living meaningful lives, and we need to make sure that they have caregivers who are trained and well compensated to provide the support that they need. And so we need a fundamental shift in the way we think about the fabric of this country. And I'm hopeful that we are getting there, that people understand now the role of public policy, and that they become, as a result of this pandemic, more empathetic, to your point.
Right now, Razia, I mentioned earlier that a lot of the model of philanthropy in this country is expecting rich people to come save everybody else. But one thing that does often happen in these discussions is about a fairly erudite, well-to-do people speaking on the plight of those who they may empathize with and wish to support, but do not have firsthand knowledge of what their circumstances or situations are. So from the ground of the work that you're doing with people, what are things that you think that people don't really recognize or understand, even though they may be concerned or want to help?
I think that we don't realize that we're interconnected. You might think that because you don't have to experience diaper need, that it doesn't exist. But the reality is, every time you go into a grocery store and there's an underpaid cashier there, sometimes within our own families, the people who serve us food, who do work for us, those are people who are affected, and in turn, you are affected. If a wage is not being paid well, and that person's frustrated and they still have to come and do a work for you, you might get the brunt of the frustration of something that's going on in their lives. So it's just disconnecting yourself from what someone else is going through because you don't directly have to deal with it, I think is something that we are completely guilty of. I don't think it's really a status thing. I think just in general, I don't have to work at McDonald's, so I don't always empathize with the woman taking my order when she's kind of upset about something, because that might have happened during her day, or she might have had a healthcare issue or a child care issue. We don't think about it because it's not us.
Yeah. And I think one of the things in the pandemic that I think I've been fairly hopeful about is some things that we probably had not thought about so much just relayed so bare. So one thing, for example, is school and the role that school plays in feeding people, which is something that I had never considered. Like, I thought about it when I started going to public schools when I was 7 years old, and kids were coming in to go to breakfast, which was like, wow to me, because you had to be there at like 7:15. I'm like, who wants to wake up this early to go to school? My life was not one where it ever dawned on me that that's where the breakfast is, right? Like, if you wanted to eat something at this point, and I imagine for a lot of people that would go to schools and see that people were coming in for breakfast, not recognizing the role that plays in them. Like, so many of these things just seem to be so close to people's faces, but they're not quite catching like what the rationale and reasoning is that people do some things. Like, and not even things that you look at like, why are you acting like that? But just very simple things,
Oh, I absolutely agree. I actually work in a community center, and we have a virtual learning support center program, which it's so simple, but it's so complex because a lot of these children would be left at home alone. They would not get 3 hot meals a day. There are families who don't know how to deal with each other because they were so dependent on being able to send their child to school all day. That's like a respite for them. The child gets to interact, 3 square meals a day that the child may not get. But again, it's sad that we don't think about just even the availability of internet. Some communities have no internet, no broadband availability, and we're asking them to stay at home and go to school. outside of the fact they may not have the equipment, they might not even have the capability, you know, to do that. And we don't think about those type of things, which is disturbing to be in such a prosperous nation that can look down on 99% of its residents overall and say, you know, you don't really need this help. I mean, and not even realizing that those communities don't have a specific look. They can be in a rural setting, they can be in an urban setting, they can even be in the suburban setting. We just we detach ourselves if we don't have to directly feel the result of it. And that's the one thing I personally learned from the pandemic is we all are connected. You know, you don't wear your mask, you could make me sick, whether or not your belief
Right.
on why you're not wearing your mask, whatever that might be, you can actually make me ill.
Yeah, and I've been glad to hear your emphasis on the experience of people who live in rural communities in this time, because that can be, especially for people who live in cities, can just be something that's easy to forget. Like when I hear you talk about the internet, I remember a buddy of mine, he does a sports talk radio show in Kentucky. And every year during the summer, he goes around to every county in Kentucky. And that can take you to some far off places. And one thing I always remember is he talks about when he go in and he'll do like a broadcast at like the local drugstore, something like that. Maybe 5 or 10 people show up. And a guy will come up to him and say, "Oh, yeah. I check out your website when I go on the internet." And when he goes on the internet is once, maybe twice a week, because people who are immersed in that world think that everybody is immersed in that world. And for a lot of people, like availability to high-speed internet outside of telephones is not something that everybody has. Like when I was growing up, it was, could you get cable at your house, right? The people that lived on the back roads, they were the ones that had the satellite dishes. That's the same stuff as the internet for a lot of people.
Right.
Yeah, and I just want to give a quick shout out to the folks that are participating in this fly-in, because, raising awareness of these issues, making your voice heard, working collectively, we can bring about the policy changes that we need to really support families the way they need to be supported in this country. And so I commend Joanne for putting this on every year. I know we're doing it in a virtual capacity this year. I look forward to being able to get to it in person again, but it's just a critical piece of this. And I just thank all the diaper banks who've taken the time to participate in meetings with policymakers.
Right now, we've talked about, I'm sorry, was somebody trying to speak? I may have.
Oh, I just wanted to throw in a little bit about going back. First off, thank you, Stephanie. It's not me. Philip does all of the work, and we really do have to give him kudos for this. But the issue of reaching people in rural areas, a lot of our diaper banks do that and have really interesting models for doing that. Some of them have mobile pantries that they take to certain areas. Some of them, an example is the Diaper Bank of the Ozarks. There's a lot of rural area near them in Missouri, and they actually have set up their own network of diaper pantries so that they're able to reach so many more people in those rural communities. And so I do think that thinking about, as Razia is doing and others, how we reach people outside of our urban areas is really, it's something that we all spend a lot of time thinking about. And, we need to do more, certainly, and we continue to, but I think a lot of diaper banks have some pretty interesting ways of addressing it.
All right. Now, we've been talking about the lack of government assistance for this cause, but why don't public dollars cover diapers?
I'll start, and then anybody else who wants to jump in can. I think that there are a lot of reasons. First off, most people, when they think about policy, the first thing, and this is true for me, 18 years ago when I started thinking about this, I thought, okay, food stamps, SNAP is the right vehicle for this, or WIC is the right vehicle for this. And what I've learned is it's not. So SNAP benefits are a nutritional subsidy, and they can't be used for hygiene products, paper products, cleaning supplies, all sorts of things. But I think that there just has never been a focus on the little things. The government tends to think about the big things. They think about housing. They don't think about what does a family need to move into a house, right? It's one thing to give someone a Section 8 certificate, but if they don't have plates and, pans and utensils, they're not going to be able to make that apartment their home, and they're not going to be able to maintain it. And I think that diapers are just like that. There's something that, for whatever the reason, policymakers have thought of as a luxury. The same goes for period products, cleaning supplies, these things that so many people take for granted. I think it really, until we started doing this work, that people doing work related to basic needs, as all of our members do, until we started bringing this up really concretely, I don't think most policymakers ever thought about it. I don't know if that's, the same thought you guys would have.
Yeah, I mean, I think you're absolutely right, Joanne. And I would say it's not just the little things, it's the little people, right?
Yes.
We as a country are really ambivalent, and that's being generous, about the place of young children in particular in public policy. And so babies and their families are often overlooked. I mean, that's why we started Think Babies, right? That's why the National Diaper Bank Network exists in some ways. I know it goes beyond that, but to raise awareness of the unique needs of young children. And for far too long, I think, there is a sense that this is in the domestic realm, right? What happens, diapering is something that's private. Period supplies are something that are private. And so why should government come in and support it? But it becomes a government issue. It is a government issue regardless. So if we are not diapering babies, if families don't have what they need to provide adequate diapering for their young children, it comes to the government's attention other ways. As a public health concern, when babies have diaper rash, when parents are at their wits' end and don't know how to care for their children because their child will not stop crying because they have a diaper rash. That often results in government involvement in some way. If we were to think about, and it's usually more costly, if we are to think about this again, that social contract, that making sure that families have what they need on the front end, the costs are significantly less than if we ignore it and pretend like what happens at home doesn't really matter. It will matter at some point, and we will end up paying for it later on, and it's more expensive, and we have squandered the potential of children. We have squandered the potential of parents who are so stressed out about caring for their families and not being able to do it, that they aren't productive at home. They're at work. So we pay for it one way or the other. Let's do it in a way that is actually productive for society, or more productive.
Can I add one more thing to that, which is, I think another part of the reason that we don't pay for things for children goes back to the whole issue of deserving and undeserving. And we think so little of parents who are not able to meet all of the needs of their child financially. And I do think that that's a really big part of it as well.
And I want to make a point, Joanne, you can relay this, that when I met you and I was first becoming aware of this, and I just hadn't thought about it. And it really was just a thing I had not thought about. And I was just thinking, diapers and period supplies, there is no making those stretch. Like, some things are not intended to be reused, right? Like, you can even wash a plastic fork, but this is not like, this is not the game. This is not going to work. And I just really stopped and thought about being a baby and sitting in a dirty diaper, and just thought to myself, man, that sounds stressful, right? Before we even get to talking about mom and having to deal with it and everything else, just literally imagine being a helpless person sitting in your own waste and literally unable to do anything about it. Like, I just thought about it like that. I was like, oh, yeah, cool, let me give you some money. That doesn't sound like something we should, just allow to continue. It sounds miserable, But I think that it sometimes it really is on that basic level. Like, I think a lot of the macro numbers that we've talked about really matter. But if you just fundamentally look at it, and period supplies become a thing because close to half the population literally never is in a position or a place to think about it, right? And that one, I think, often gets lost in part because it's harder to have a public discourse about it because ew, gross, right? Like people in general, men in particular, get to this place and they can't walk down the aisle of the store. But this is something that a lot of people deal with and need their help with. I know we want to try to get to some questions from the audience. I'm scrolling through here and seeing what we have there. I want to thank again the panelists, and everybody has been fantastic on this. And actually, I'm seeing it's a whole lot of attaboys and you go girls in here, but not a lot of question marks. Joanne, I want to ask you this question. How can people give diapers?
So people can give diapers in lots of different ways. You know, most diaper banks, I'm sure Razia has a wish list on her website. Am I right, Razia?
Yes, I do. And you can also find me on Amazon and Amazon Smile. Shameless plug.
Yes. Most diaper banks do have that. If for some reason the diaper bank near you doesn't have one, they will happily accept large size diapers. But the truth is, it is easier for most diaper banks if people donate cash. We're able to, through the generosity of some manufacturers, to be able to buy diapers at a deeply discounted rate. And so, they're able to buy more that way. But diaper drives are an amazing activity for families and for, different social groups and things like that. And on our website, we have information about how to host diaper drives. And I would venture to say that 99.9% of our member diaper banks have that on their website as well. So that's the best way to do it. And we do have on our website a listing, so depending on where people are, you're welcome to go to our website, find a diaper bank, and all of our members are listed there on a map, and you can find the diaper bank that is closest to you. And I'm sure, and Stephanie, you can certainly correct me, that people can, buy Huggies online and donate them to diaper banks across the country as well.
Now, Myra, how can we push local, state, and national elected officials to enact policies or to push policies?
Thank you. So I think, engage at the National Diaper Bank Network is huge, and Philip does a great job of policy and advocacy there. Sign up for our policy network. We would love to have folks join. You can go to thinkbabies.org and learn how you can become a big voice for little kids, and really think about, and there you'll get actually a whole kind of breakdown of all the policies that we're pushing for, and you can engage and call your members. We make it very easy. We have a lot of toolkits. You can just tweet it out or send it, pick up the phone. We make it very easy for you to reach out to your members of Congress, and they need to hear from you. And they most definitely need to hear from us for the next year. We have to make these policies that were so, such a seismic shift, they have to be made permanent. They are not permanent, right? This is right now, it's a process of thinking about, just getting us through the pandemic and getting us on to the other side, but we need to make sure that these things need to stay in place. The child tax credit is fundamentally a game changer, and we need to make sure that it stays there. Because I will just say this, before this expanded tax credit was just passed, we were missing 39% of all children.
Right.
Because even though their parents were working, they may not have been earning enough to make them eligible for that non-refundable credit. So now that it is refundable, it's a game changer for those families. And so get involved, sign up there, and we would love to have your voices.
All right, now we have a question from the audience from Jess, and she asks, I am curious why so many banks cut off at age 3 and what services or supports are recommended for the families whose 3-year-olds are still in diapers.
Razia, do you want to answer, or should I?
You probably have a very technical reason that you stop at 3. I think this might be, I won't say cultural, because I know many diaper banks stop at 3. I think a child should, unless there is something medically wrong, they should probably be headed towards weaning out of diapers by the age of 3. But there are things in place. For Every Bottom Covered, we're actually starting a potty program, because we do understand it is an abrupt stop to just tell somebody they can't come back next month because the child turns 3. So you want to incentivize for the families being able to have some potty training support. Sometimes a support issue or a scheduling issue that will cause a family to go past the age of 3, but that's just the age that has been recommended. And that's the age that we stop at personally.
Yeah, and most diaper banks, many diaper banks say 3, but actually have some level of flexibility. We need it most of the time. Most kids are finished by 3. Many aren't. And then, we try really hard to find diaper banks that will help them. The other thing is, if the child has a medical issue, there are ways to get diapers once they're over 3. And that's part of the reason that 3 was that cutoff, because once the child is over 3, we can begin to look at ways to get diapers paid through Medicaid, having to do with, if there is a diagnosis that is making it so that the child's not able to be toilet trained.
All right, now I got one last question because we got to hard out. Or actually, no, I was just told, no, we don't have another question. We are about done here. I want to thank everybody so much for joining us here. Thank you to Stephanie Childs of Kimberly-Clark. Thanks to Joanne Goldblum of the National Diaper Bank Network. Thanks to Razia Hill of Every Bottom Covered. And thanks to Myra Jones-Taylor of 0 to 3. And thanks to everybody who has joined us. And, if you want to donate and act like you're a great Buffalo Bills fan, go to ilovejoshallen.com. Yes. It's right there. It's available for you. No, it really will get you to a place to donate to the National Diaper Bank Network. So thank you so much to everyone for joining us today. And thank you for allowing me to participate. And I hope everybody has a good rest of the day.